Biotin by Lily Villaseñor and Mona Correa. Biotin is a water-soluble vitamin that can aid in the process of metabolizing fats, carbs, and proteins. Biotin functions as a coenzyme for enzymes that can add CO2 to compounds involved in energy metabolism. Biotin also activates enzymes that synthesize fatty acids from acetate formed from acetyl-CoA. It also aids in the metabolism of the amino acid leucine. Biotin converts amino acids into compounds that can be used in the TCA cycle. Biotin, also known as vitamin B7. It was discovered by doctors in 1914. By adding raw egg white to a balanced diet, it resulted in dermatitis and hair loss, depression, and nausea. This was caused by the binding of vitamin biotin with a protein found in egg whites called avidin. Avidin can bind up to 4 molecules of biotin, which renders the vitamin available for absorption. Dietary sources: liver and other meats, egg yolk, yeast, nuts and seeds, salmon, dairy, avocados, sweet potatoes, and cauliflower. These are some examples of the food that biotin is present in. DRIs. The average biotin intake from foods in other Western populations is about 35 to 70 micrograms per day, indicating that most people in these countries consume adequate amounts of biotin. The AIs are from age 0 to 6 months. They should be having about 5 micrograms per day. Age 7 to 12 months, 6 micrograms. Age 1 to 3 years, 8 micrograms. Age 4 to 8 years, 12 micrograms. Age 9 to 13, 20 micrograms. Age 14 to 18, 25 micrograms. And 19 and older, 30 micrograms per day.
Deficiencies. Deficiencies are also rare because biotin can be synthesized by bacteria in the intestinal tract. If an individual eats more than 12 raw eggs a day, biotin deficiency can occur. It can also occur in patients receiving total nutrition intravenously when the GI tract is not functioning. Crohn's disease or ulcerative colitis and rare genetic disorders can occur. The symptoms of deficiencies. Dermatitis around the eyes, nose, and mouth can occur. Conjunctivitis, hair loss, and alterations in the central nervous system resulting in lethargy, hallucinations, and depression can also occur. Toxicities. Even up to about 200 milligrams per day, not much evidence on consuming too much biotin with having toxic side effects is found. Although taking biotin with some drugs, herbs, and supplements can be toxic. Study 1. Biotin is a water-soluble vitamin that helps the body metabolize fats, carbs, and protein. These vitamins are not stored in the body, so daily intake is absolutely necessary. Biotin has many health benefits, some that include synthesizing or creating fatty acids, gluconeogenesis, and synthesizing or creating fatty acids. Some other benefits of a healthy biotin intake include maintaining a healthy pregnancy, healthy nails, hair, skin, lowering blood glucose, controlling neuropathy, biotin responsive basal ganglia disease, and treating multiple sclerosis. Biotin deficiency can cause biotendinitis, which is an autosomal recessive metabolic disorder. Biotin supplements are taken to avoid hair loss, brittle nails, mild depression, and diabetes. Study 2. Biotin, the forgotten vitamin. Biotin was discovered in nutritional experiments that revealed a factor in many foodstuff that was capable of curing the scaly dermatitis, hair loss, and neurological signs induced in rats fed dried egg whites. The fact that humans have a requirement for biotin has been most clearly shown in 2 situations that result in biotin deficiency. The first one is prolonged consumption of raw egg whites, and the second is parental nutrition without biotin supplementation in patients with short gut syndrome. These gaps in our fundamental knowledge about biotin requirement must have arisen from at least 2 sources. First is a lack of analytical tools to quantitate biotin in body fluids and the metabolic disturbances caused by biotin deficiency, and the second is a lack of experimental validation of pituitive indexes of biotin status. Conclusions are that the incidence of marginal biotin deficiency should be assessed by a complementary index of biotin status that does not depend on maternal renal function, if such an index can be discovered and validated. Moreover, a causal link between maternal biotin deficiency and deleterious effects on the fetus or mother must be established. Finally, both the appropriate dosage of biotin and the timing of the dosage with respect to conception required for therapeutic efficacy must be determined.
Thank you for listening.